Hello everyone. This is David. Again, coming to you with some of my thoughts this period. I hope everybody's doing fine. I hope we're all practicing safe measures and staying at home unless you're like an essential worker um, to prevent the spread of this virus, the COVID-19 virus. So, mm, this is my second video on during this whole outbreak or the pandemic. So this is just to let people know like how I or what I'm thinking in this period. So if you've heard, there's a new move to open up the economy because COVID-19 practically paralyzed the economy of the world, and people in the United States here are really feeling it, with a lot of people now filing for unemployment, a lot of workers being told not to show up to work anymore. And it's, if you have daily bills, it really um, puts you into some form of hardship. And even with the stimulus check, it's really nothing, you know, compared to the amount of things you need to handle. So the debate now is, do we hurriedly open up the economy so that the economy can bounce back real quick and stop this hardship that the entirety of the country is facing? Or do we continue what we are doing and ensure that we keep this virus spread at the barest minimum so that we can save lives that might be lost if we go back too quickly? So the debate, I coined it the debate on economy versus public health. So this is the first school of thought. Some people believe that the economy crashing hurts everyone. So this is the many versus the few that will be lost by this coronavirus. And they have the opinion that since the percentage of people that die from it is not as high as some other disorders that are sometimes not contagious, because they've compared it with the flu, even road traffic accident, that we can open up the economy and just let the thing play out. That's the first school of thought. Now, the second school of thought, and that is the one that I share because I'm in the healthcare system, so I can see the impacts that this has on just not just the individual that has the disease, but the family along the line, because you can never be for an argument, or you will always be against an argument till that thing begins to happen to you, or you have a direct link to it. So we've seen it up close, people dying, you know we see it every time in the hospital system. And the hasty opening of the economy will just mean that everything we have done right now, the shelter in place and all this quarantine that we've done, would have been for nothing, because there's going to be a rebound. And that rebound, no model can tell you the amount of lives that will be lost, because at this point there's still no definitive treatment, and there is no vaccine for it yet. So my thought about this is, first of all, the model I have in my head can only work if three things are available: ability to test about 30 million people a day, that is, testing everyone to have a snapshot of who has and who doesn't have it. Then personal protective equipment and face mask on steroids, so that everybody can, just the way you can go to the market and buy your tissue paper, all these commodities, you can get a face mask. And then three, doubling of the health facility and personnel that will be required if we start getting overwhelmed. So in this model, when you reopen the economy and let people go back, first you have to ensure that everybody is going out with a face mask. People cannot live without a face mask, and still will practice the 6 feet apart social distancing stuff. Then testing at county. Every county must have, a testing area that is a walk away from wherever everybody lives. And then the health personnel on steroid. You have to have health facility and personnel to handle the load of people that will show up if you open the economy back. Without these three things in place, the reopening of the economy will not work effectively the way you think it will be, because the virus will end up shutting it down again. So that being said, I understand the argument of the first group of people that think that we should. I understand everybody's hurting. A lot of people don't have a job right now, and they are on this unemployment check, and it doesn't cover your bills. So I can say categorically I understand that, and really it will be very arrogant for people in the health sector and like people that have all this scientific thinking to be dismissive of these people's opinion, because you just have to explain it. You have to explain it and look for a way. It's a very difficult decision, especially for those in political um, posts and in government. It's a very difficult decision to tinker within opening the economy and this. So the debate of economy versus public health should be had in a more understanding environment, where you can understand the working man, what exactly the working man is facing daily, as so they have to cut hours, or they have to take pay cuts, or they have to be laid off. You have to understand that, and you have to juxtapose it with the health of the community. So that being said, I want to know what you think about this whole idea of um, the economy versus the public health issues. And yeah, that was just what I was thinking about right now. And to conclude it, like I said, I think even if you have to open the economy, those three things have to be put in place before you do it, because if that is not done, the figures we're seeing now will be a child's play when it comes to mortality rate of this of this disease. And you can already see that it's disproportionately affecting those in uh, low income communities and all that. um, um, Also amongst Black and Latino communities, the mortality rate is high. So when you're having the argument, understand that you might be healthy right now, and you might get affected and succumb, or you might get affected and get back to normal or recover, but you would have infected people that would succumb to the disorder. So think about it that way, because it is head over passion, head over passion, or passion over head. Are you passionate about, like, your neighbor or whoever you come across falling sick and succumbing to it? Because that's a scenario that can happen. Can you in good conscience take that? If you can, then I don't have no question. But if you can't, think about what the health community or the healthcare professionals are saying, and let us try to be sensible in the way we try to reopen this economy. I don't mind having head count of those that are going to be in a restaurant, where there might be a bouncer that will be in front to ensure that capacity of the restaurant allows for social distancing, or even calling ahead to make appointments to be in a restaurant or in an area where, and like I said, everybody wearing face mask in order not to spread whatever they have, or get inhale from other people's source or other sources. So that's my take about it. So what do you think? Just share. If you like the video, like it, share, and just let me know what you think. Take care. Have a nice Sunday.